excess of anything is bad, right? So where there are too many fads right now, like there's sudden bombardment of GI health, and so all of it is driven, right? Sometimes there may be some companies who may drive it. So one has to be a little, our predecessors survived for 80, 90 years. So obviously they ate right only. So Indian food is good food, just try and be normal. But yes, what is required to be done is required to be done, right? So for example, if you're pregnant, you have to do a test to know whether the child is going to be normal or abnormal. So there are certain things which have to be done. Similarly, if you're crossing the age of 40, you obviously need to check, your cholesterol, other things. If you are, if there is a family history of cancer, you need to check whether you are predisposed to it. So there are some basic things which one has to keep in mind, but there is no need for us to get excessively worried about it. But one thing I would advise, since I am an oncopathologist, stop smoking if you're smoking. Because it's not only lung cancer, because there are 14 kind of cancers that it causes, right? So these are some things like, similarly liver disease, we've seen so much predominance again because of alcoholism. So moderation, everything is fine. I'm not saying stop drinking, but don't become an alcoholic. So just simple things.
So could you share some closing
for
thoughts?
a very common person, I would like to say it's very, very important to stay healthy. And you can only stay healthy when you know about your basic parameters. So one thing is very important to get themselves and their family members tested at a very regular interval of time, at least for the basics set of parameters. And also choose a lab very wisely. Don't just walk into any of the lab or the center. Make a list of checklists, whether it has a pathologist or not, whether it is NEWS or ISO certified or not. What kind of equipments and how much time are they taking to process a sample. Sample collection is being done through proper vacuum cleaners and all. I think these are 5-6 parameters which every person should think and see before walking into any center or any lab to get their sample done. Because each blood sample, it's not only carries the life of a particular person, it also revolves around the whole family. So choose lab wisely.
Listen to your body. Your body speaks by itself. If you feel stress, you should understand that there is a stress. You should stop at a certain moment of time. If your eyes are red, your body is saying you should sleep, so you should sleep. Don't search things vaguely on ChatGPT or don't ask everything to computer. There are doctors around you. They know more than the automation. Yes, the technology is evolving. It tells you, but it's very generic information. Doctor is more understanding. He knows your situation. If you feel something is not good with you, report it. Don't keep it within yourself. Be it a headache, or be it your shoulder pain. It can be frozen shoulder as well. Something can go wrong with you. Don't underestimate any symptom which your body is telling. Report it to doctors. Get it checked. Get it diagnosed, get it treated. That is very important.
A couple of things. First is catch the disease before the disease catches you. I think there is still a lack of awareness in terms of health, whether you should get your test done or not. And I'm coming from Rajasthan, Jaipur, Mumbai, Delhi. There is still, I think, a lot of difference in the awareness of what citizens carry. People still feel that if they get tested, they'll be detected with some disorders or something. I think it's important that you realize, accept that what test needs to be done, and you need to be aware on that. Second is know your lab. I think it's very important to know. It's just not you giving your sample to a phlebotomist who's coming to your home. It's also much beyond what goes behind the scenes and what goes in the laboratory. I think it's important to know all of that. We talked about compliances, role of NABL, and all of those checkpoints that impact the integrity of your result. I think you should be more aware about all of these factors.
Any last words?
I think as an educator, what I see in the students is addiction to social media, phones, and belief in what social media is saying. I think for the lay public, that's very important. What comes on Instagram, Snapchat, and Facebook is not the truth. Google Baba is not a good doctor. Please don't believe everything that comes in social media. WhatsApp University is a lot of fake things happening. So a lot of problems can be avoided. You do the wrong things because you believe the wrong things, and then once you avoid those things, then everything becomes easy. But I do think mobile addiction is a very bad addiction to have. It's very prevalent in our society. All of us, including our children, are having it, and it's time that we let go of this because it's straining your eyes, it's straining your body, creating mental stress, all of that. And in every lab, in every center, in every hospital, yes, the technology, the machines are good, but always remember that man is better than the machine. It's important to trust the man, the doctor more than you trust the machine. In every machine you put in garbage, you get out garbage. So I think the doctor is more important.
You spoke about mobile. We don't clean the mobile, but we use dirty hands to handle the mobile. Is the mobile also? We may wash the hands, but again that's the same. So is
I
that
think we can live
also
through that. We can live through that. There are a lot of dirty things around that we do nothing, so that's okay. But you keep looking at the mobile and you're polluting your mind. That's more important.
Sir,
Yeah,
what tests should we recommend to the general public? कि भाई ये तो करा लो.
See, the problem with this is that there is no like one size fit all sort of a scenario in India. And like you said, there is an overwhelming advices and overwhelming information available on internet which can be carried away. Because people just say, now I've seen social media trend of people telling which test to be taken when you have something. Even if for a dry eyes, they have started telling a test. So I have never heard of it. And this has been
You're happy.
no,
Patient is coming to our lab.
but it is actually a misinformation. So ultimately, people think that companies like us probably are promoting those, but however, these informations are not correct. So that is why everyone has to understand their body first. What do they need? And you always have a sounding board, and that sounding board is your doctor, right? So you should always go when there is a confusion rather than just taking. Because today, if you go on the same internet page, you will find 5 different tests being prescribed to the same sort of a people with the same sort of a problem. So what is correct is not. The information is like it's an overload of information, right? Because everybody wants little eyeballs, and the eyeballs only come when they disrupt things, right? So you have been seeing somebody saying that having sugar does not create diabetes. You will read about it because you actually want to have sugar, right? But that's not true, right? And if they just say don't have sugar because you have diabetes, will not look at that post. So all information that comes to you is not true, and you have to really filter that information out before you really go for it. And there cannot be a single test